Hey, everybody. Hey, Mila. Who else is here? We have Mila. We have Veronica. Hi, you all. And so, you all, it is night shift with Nurse Eunice. I know some of you all just finished watching one of our videos, and so you're moseying over here. Hey, everybody. I wish I could hear your voices, but I can read the chat. So let's talk about it. How are you feeling? How's your week? And what questions can I answer for you? Whenever I use this particular streaming software, I go live. Sometimes we have interference. So if you're not able to know, hey, Karina, where are you located? And then what questions do y'all have for me? And Thea says, good night. And Thea, are you going to bed already? Mila, I am having a wonderful day. Thank you for asking. How is your day going? And sorry we've been having so many technical issues with this streaming service. But I'm happy to finally get on here, answer your questions, tell me how your studies have been going. Let's see if we can help you all pass your examinations. And so Karina is in the UK. So thank you for joining us, young lady. All right, and Veronica, I'm doing well also. How are you? And so this is just open question. Let me know what questions you may have. I'm here to answer whatever questions, whether it's about CNA, if it's about CNA to nurse. Um, oh no, you are so fine, Mila. It's okay that you missed this morning. Mila, you have a life outside of studying. So how's your studies going, Mila? And so this week in Florida, I'm in Jacksonville, Florida. So this week we have our NCLEX review courses on Thursday and Friday. So tomorrow's the day we set everything up. So tomorrow's when we set our NG tube stations, our catheter stations, our IV therapy stations. So, we have to be in there with all the mannequins getting everything working. We have one high fidelity mannequin where you can listen to the chest, you can auscultate, you can hear heart sounds, lung sounds, etc. So we get all of that set up on the day before our NCLEX and Nursing Skills Lab. And then on Saturday, we have IV therapy for nurses. Believe it or not, a lot of your nurses are not taught IV therapy while they're in school. So the first time they actually stick a human is the first time they stick a human because if they did practice in school, they practice on a mannequin. And so we just make sure they understand their skills, they understand the safety behind starting IVs, how to draw blood from PICC lines, etc. And so that is my weekend. So let's see what you all have going on. All right, Anthea says she is trying to do LPN. Well, I am proud of you. A lot of people feel that, going from CNA to LPN is not a good ideal. I don't think that. LPN, you all can do anything for 1 year. In LPN school, if you have a CNA license, some of your colleges have a CNA to LPN bridge option where they give you credit for being a CNA for longer than 6 months. So look into that. Otherwise, LPN school is only 1 year. So you're a CNA, go to LPN school for 1 year. You're going to be a nurse. You're going to make good money. You're going to now be eligible for tuition reimbursement, and your facility that you work at can help pay for your RN schooling. And so from LPN to RN, that's another bridge option. That in itself is another year. So literally in 2 years, you can go from CNA to LPN, LPN to RN. And so I hope that helped you, with your decision. But I think being an LPN, especially with this economy, and we all have, scheduling conflicts, and we may not have the best support system. I think that piecing it, doing LPN to RN, is a great route. All right, let's see what Mila has to say. Mila says, you're going to be a 911 operator. You go. Oh my God, it's phenomenal. Yep, I just know you're going to make one of the best 911 dispatchers operators. If someone doesn't know what to do, I know they can call you. You're going to have your system there. And so you'll be helping them handle emergencies safely from an air conditioned building versus being on the front line, being a paramedic or EMT. So I think that's wonderful. And then Jonathan is watching from Guyana. So thank you all so much. Does anyone have any questions? What questions do you all have? I want to make sure that I'm here as a resource for you. Now, Karina, can you let me know what MHN stands for? Is that mental health nurse? Because we're in different countries, I want to make sure we're using the acronyms correctly. But if you love mental health, may God bless you. I've worked psych. I've also worked hospice. And so why did I, connect mental health to hospice? Because you got to have, a different mindset if you're going to be working, taking care of people who are at the end of their life and then also taking care of their families. But then on top of that, working psych, I've been a charge nurse in a Baker Act center. So I do have a heart for those who work in mental health and who takes care of those who have emotional. And we have our Vivian, she's from Florida. And then Mila says she's looking forward to it. So you all, what questions do you have? No questions? And so if you all of another platform we can get on where I can actually hear your voices. I try not to go on Zoom, but if we need to go on Zoom, because I would love to be able to, hear your voices and celebrate Mila when she becomes that 911 dispatcher. All right, looks like we have a question. Let me see if I can pronounce your name. Saiwania. I think I said it right. So Saiwania, I have been a allied health test. I have a allied health test coming. Any tips on how to study and where to start? It's in 2 days. All right. So you all, when you are studying for your examinations, usually your professors will give you a syllabus. They'll give you an outline. And so I'm always going to start off with that rubric, that outline. That's going to help you. It's going to tell you what's going to be on the test. And you can't remember everything. So when you say you have an allied health test, it's just going to be a written examination, multiple choice. What topics or what chapter did you cover? So I'm going to say, go with the syllabus, go to that first, and then review your notes. What did your professor say was important? Did you take notes or did you record? You all, there's an app called Fetch. I think it's fetch.com, where you can have it on your phone and you can record your lectures. And then at the end of your lecture, it will create your lesson plan for you. It will create your practice questions for you, all from just listening to your instructor speak. And so if you are having a hard time maybe understanding what your instructor wants, I would recommend that you use an app like Fetch or another type of study app that will not only record the whole lecture, but then create your practice questions for you. So good luck on your test, young lady, and I know you will do well. All right, refer back to your notes. And then Mila wants to know, how's my mom doing? She's been a bad patient. Oh my God, it's so hard raising your mom. I can't do it. So she's doing well. She's extra feisty and she does not listen to me. She doesn't care that I'm a nurse. So I'm just her daughter. And so Karina did say that MHN stands for mental health nursing. So girl, I know you're going to do well with that. Congratulations, and let us know how you progress. All right. So Veronica says, does it have to go in stages? Can you go to CNA to RN? You certainly can, especially if you have the family support or you have the resources. When I went from CNA to RN, I got my bachelor's, but I was like 17 and I finished school like as soon as I turned 22. Because there's a lot of prerequisites and I was at a university. So getting all those prerequisites done, they don't usually tell you, that's going to delay you. And so if you want to go from CNA to RN, one of the least expensive ways to do so, if you're in the States, would be at a community college. So you can contact them, get a tour. You all, whenever you go in these different colleges and you are touring, I want you to not just be impressed with their facility. I want you to ask them about their NCLEX passing rates. Because right now in the state of Florida, about 15% of all nursing students fail the NCLEX. So that means they've paid $40,000, $50,000 to attend a program, but then they can't pass the actual exam that makes them a nurse. And so you care less about the aesthetics of the school and more about their student support, their passing rates, because if they have a higher passing rate, that means that their instructors, their professors are going to put extra work into you to make sure that you're successful. So yes, you can also go CNA to RN, but just ask about those prerequisites and then add that on to the time, because if you have to do 2 years of prerequisites based on your schedule and then a 2-year program, it took you 4 years to become an RN. And for LPN, you usually don't have as many prerequisites because they actually include those into the program. So I hope that helped. All right. And so Vivian said, when do you go live? Girl, I don't know. I be trying to go live. Lately, I've been having technical issues, so it's been hard. You all haven't been able to hear me. So I try to go live at least twice a week, but it's never a schedule because we have a full-fledged business here in Jacksonville, Florida, where we have classes 7 days a week. And then on top of those classes, I try to get online to meet you all. So I don't have a set schedule, but if you turn on your notifications, you will be notified whenever we do go live. And Mila's talking about, trying to raise your parents. Yeah, that be the shenanigans. And if Veronica's in Florida and she thanks me. So you all, if you all don't have any questions, you don't have any questions. Oh, Veronica, girl, I'm about to lay my hands on this computer right now. And girl, I'm going to pray for you because you is going to do fine on your exam. You're in Florida, so when you mess up, you say correction. All right, let's go ahead and do it real quick. Let's do an introduction. Knock. Good morning. My name is Eunice. I'm your CNA today, and I'm here to take your pulse. Is that okay? Before I begin, let me go wash my hands. And so we have a whole playlist that talks about the clinical skills videos. And I know at this point, your test is tomorrow. You need to be sleeping, but I do wish you much success, and I know you're going to be successful. So good luck, girl. Come back and let us know how you did. Yes, thank you so much, Mila. Yep, our CPR video, it really helps. You love that video. I think that video it has over 700,000 views. And so you all don't be afraid to get out there to get on camera. So you being an online educator, everything shouldn't be behind a paywall. So if you know something, if you're knowledgeable, if you know how to cook, I don't care what it is, I need for you to turn on that camera and just start. You don't have to be perfect. You just got to be present. And so me teaching people CPR for free, 22 minutes of CPR, and now over 700,000 people have watched it. That is amazing. And, I just appreciate God for showing me my purpose and, and also allowing me to punch fear in the face and get on camera and help other people. So, and then Veronica said, thanks loads. All right, you all. So you all want practice questions? What do you all want to do right now? You tell me what's on your mind. What do you want to do? Otherwise, I'm going to go to sleep. Let's give Veronica 10 practice questions. Let me see if I can find some practice questions real quick. All right, let's see. Veronica, I'm going to go to an old one. Veronica, for the med aid or med tech, it's like, I'm sorry, I think that was Mila. For med aid or med tech, it's like you're taking all these different classes that will not result in an increase in your pay. So it's like all of these classes are the same level. So whether you're a 911 dispatcher or you do med tech, I need for you to really figure out what your goal is, because all of those are on the same pay scale. At some point, I'm gonna need you to step above so you can make more money. And one of the easiest transitions would be LPN, but I'm not sure if you have your CNA license yet. So just think about the physicalities with that. You still got to be in a facility. A lot of those medication techs, they still are providing patient care sometimes because they're usually a CNA/med tech. And so if you don't want to do CNA at all, I would not recommend med aid. All right, let's see. All right, Michelle says she wants a practice test. Veronica says practice test. Roxanne is from North Dakota. I've never made anybody and you are a beautiful girl. I've never made anybody from North Dakota. So hi. And then Karina wants the CPR link, so give me a moment. I will put that in there, and then let's start these practice questions. So this is an older test. It's from a few weeks ago, and let's see. Oh shoot, probably shouldn't have showed you that answer. All right, so let me hide this. Let me hide it. I'm gonna hide myself. All right, you all. When transferring a patient from a bed to wheelchair, where should the CNA place the wheelchair? Yes, Mila can answer the question too. Is it A, at the head of the bed, B, at the foot of the bed, C, parallel to the bed, on the patient's stronger side, or D, perpendicular to the bed? All right. Veronica says C. Anybody else? Mila says C. Roxana does her clinicals on the 8th. All right, and so revealing the answer in 3, 2, and you all got it. That was way too easy. Let's see if we can get something else. Nope, that's easy. That's easy. I gotta find something hard. Her test is tomorrow. All right, so question 8. What is the proper way to measure a patient's urinary output? Is it A, estimate the amount visually, B, ask the resident how many times they urinated on your shift, C, pour the urine into a measuring container and read at eye level, or D, weigh the patient before and after voiding? All right, looking for the correct response. Let's see what you all have for me. Yep, you all got it. Michelle, girl, these are too easy for you. Roxana, Mila, I know it was way too easy. You all I've only been practicing about a million questions. That's why you all need to go ahead and go to nursing school. You all know all the CNA questions already. All right, I'm gonna let you all read the question 12 while I bring up that CPR video for another student. So you all have answered all the questions. All right, and I'm entering the link now for the CPR video. As soon as my phone catches up. All right, you all. This one was D. So let me go back and read it. So you're caring for a debilitated patient who screams loudly each time you attempt to turn them in bed. What is the best action for you to take next? A, stop turning the patient and wait for the next scheduled repositioning time. B, leave the room and come back later when the patient is calmer. C, immediately apply restraint to prevent the patient from moving. Or D, gently explain what you are doing and continue to reposition slowly while observing their reactions. And so just because someone's screaming doesn't mean that you would restrain them. So it is going to be D. You're going to talk to them. You're always going to try to de-escalate. That is right, Karina. And whoever requested the video for CPR, I know that's the long link, but that is the link for the CPR video. I promise you it is not spam. All right, so you all, we're on our we'll say this is our third question. We'll give you 7 more. What is the purpose of range of motion exercises? Do they build muscle, increase pain tolerance, improve joint flexibility, or avoid physical therapy? Why do we have our patients moving their joints? All right, so Khalees says it builds muscle. And Thea and Mila says it improves joint flexibility. So it looks like we have a lot of C's. Do the C's have it? And then Jamie or Jaime, they take their test on Monday. You all are going to do fine. We rarely have a student who fails. And so if a student fails the test, I always ask, how did you study? Of course, you can't just always listen to questions on screen. You have to actually read. And so you offer question 13, range of motion exercises do not build muscle. Instead, they prevent stiffness and promote mobility. So when you have them move their joints around, when you have them participate in their care, that's preventing them from getting stiff. All right, let's see what the next one's going to be. Oh, all right. Question number 4, even though it says 14, because we're only doing 10. Which oral care tool is most appropriate for a CNA to use when providing oral care to an unconscious patient? Would it be a regular toothbrush and toothpaste? Would it be an electronic toothbrush, a lemon glycerin swab, which they rarely use those anymore, or would it be D, foam tip swabs and a padded tongue blade? Hi, Marie. That is right. And then what position would your patient be in when you're providing oral care to somebody who is unconscious? What position would you put them in? Do we have them in the high Fowler's position? Do we have them on their side? Why does it matter what position? That is right. It is side. We're going to allow the fluids to accumulate in their cheek area. If they don't have a gag reflex and you have them sitting up in the high phallus position, they're still going to get some fluid in their airway, and you can't suction it out, and they can't cough it out. So turn them to their side, and then if you have a suction wand, you can easily remove it with the suction wand. Otherwise, you can take that tongue depressor, put a washcloth around it, and just put it in their cheek area. At no point will you put your fingers in anyone's mouth, even if they are unconscious, because they still could bite down, right? All right, that was an easy one. All right, so this one's for you, Veronica. Jaime, don't be nervous. You're going to do fine. And then Roxana said, yeah, you turn to the side to prevent aspiration. That is so correct. Adama says, I am so proud of you all. When I tell you that you all are going to make some of the most wonderful CNAs and nurses, I am so proud of you. And then Vivian says, how can I participate in the online class? We do have an online course. So are you talking about our free videos that we do on YouTube, or do you want to be a part of our online class with the test bank? I will still put that in the chat. And so you would get to it by going to my personal page, nurseeunice.com. And then when you scroll down, you'll see online CNA exam prep course. It's $29.99. All right, so a patient with aphasia is admitted to your unit. What should the CNA anticipate? So what does aphasia mean? Is it A, the resident is unable to speak? B, the resident cannot eat or swallow? C, the resident is incontinent of urine? Or D, the resident has impaired vision? And so if you don't know some of these medical terms, it's going to be harder for you to pass the written portion of your CNA test because it's never going to ask you the definition. It's going to use a medical term as it relates to patient care. So what does it mean? We have B and we have A. I know aphasia and then aphasia. They're so close together. And then Mila, just hold on. I will answer your question. And then for you all, we're torn between A and B. And so it is, make sure my computer moves, it's B. So write it down. If it's APHAIGA, that refers to the inability to eat or swallow. But if it's APHASIA, that refers to the inability to speak. So aphasia means the inability to swallow or eat. This condition may require alternative feeding methods like tube feeding. Understanding this term helps CNAs to anticipate NPO orders. And NPO means they can't have anything to eat or drink by mouth. It's not safe. You'll also inactivate those aspiration precautions. And once approved, they may need thickened liquids. And so those two spellings are there. So aphasia and then aphasia. And then Mila had, and so Mila, honestly, my chest compressions, I've always been around just big dudes in the military. Those medics, they've always done chest compressions by supporting the patient, monitoring the patient before the cardiac arrest, because my goal is to always to prevent the cardiac arrest. That's what a good nurse does, what a good CNA does. You're going to, see those indications, see that this patient is having a hard time breathing or having chest pain, and then try to get those doctors, those advanced teams in the room right away. And so I've only had to do CPR one time because I've just always been very fortunate to have a good team of male caregivers who would take over chest compressions. I love you, men. Keep up the great work. All right. And so let's see. All right, let's see what our next one's going to be. That's too easy for my team. All right. If somebody with diabetes appears confused and shaky, what does the CNA do? Is it A, offer the resident orange juice if allowed by the care plan? B, call the nurse and wait for instructions? C, check their blood pressure? Or D, assist them to their room and let them rest? So you're a CNA, you are not a nurse. What do you do if someone who has diabetes, if they appear confused and shaky? We have B's and we have C's. I know you didn't mean to put C, Roxana. So yes, everybody, because we don't know if the nurse will need to give oral sugar, so like orange juice, or if the nurse is going to need to give dextrose via the IV. And so you doing B is the right answer. Of course, that person had signs of hypoglycemia, but we don't know how low their blood sugar. Then we will determine whether or not fluids, juice, or IV dextrose would be needed. Let's see here. We'll do like 2 more because I think my camera's cutting out. All right, what does orthopnea mean? Yeah, Mila, this sucks. Orthopnea. What does orthopnea mean? All right, so I want you all to look that up. I want to know what that medical term means. What does orthopnea mean? Absolutely correct. So, orthopnea refers to difficulty breathing while the patient is lying flat. So, if you lower them and they start having problems breathing, sit them up. That usually will help resolve some of those issues until you can get the nurse in the room. All right, so question 20. Nurse states that a patient has diaphoresis. What observation would confirm this? So, how do you know if someone is diaphoretic? Would it be A, excessive sweating, B, dry, flaky skin, C, blood in the urine, or D, yellowing of the eyes? All right. Let's see. Mila gave an answer. Khalees gave an answer. We'll wait for at least 2 more answers. Karina gave an answer, Linda and Roxana. So you all revealing a response in 3, 2, and 1. You all, whenever someone is diaphoretic, they are sweaty. So that's usually a term you're going to hear as it relates to a diabetic who's experiencing a hypoglycemic episode. So diaphoresis refers to excessive sweating, often due to pain, fever, or medical conditions such as hypoglycemia or shock. Recognizing and reporting this symptom helps in early intervention. And so diaphoresis would be A. Dry, flaky skin, I think is xeroderma. Don't quote me on that one. Blood in the urine. Who knows the medical term for blood in the urine? Veronica, I saw your response, baby. I saw A. And if it's not showing on your end, you may have to refresh your chats. All right, so you all, what is the medical term for blood in the urine? Oh, Mila was fast. That's right. It's hematuria. That is great. All right, we're going to do one more question because I'm getting sleepy. I've been up all day. Ooh, 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 ooh. So anytime I turn my camera on, it starts going slow. So just want to show my face, let you all know I'm here. All right. So you are asked to monitor a resident with ecchymosis. Where should you look for changes? Would it be A, in the resident's stool, B, on the resident's tongue for swelling, C, in the resident's urine output, or D, on the resident's skin for bruising? Ecchymosis. When a resident has ecchymosis, what are we talking about? What's up, Treadmill Games? You have it. You were the first one to give me the right answer. So now Mila, Veronica, Khalees, yes, it is D. So when someone has ecchymosis, they're bruising, you all. So ecchymosis is a medical term for bruising, large purple or blue discoloration caused by bleeding under the skin. It can be a sign of trauma or clotting issues and must be documented. So who in your facility will have ecchymosis? Your older patients with thin skin who also take aspirin. Remember, aspirin thins the blood, who take anticoagulants. So let's say somebody they start acting up again, they'll be on blood thinners. And usually you're going to be able to tell whenever the phlebotomist is coming to draw blood. So their arms are going to be all blotchy and bruised. And when you look at that patient, I need you to immediately know that this patient is at an increased risk of bleeding. So you want to make sure you're extra gentle with them and make sure that you monitor them and prevent falls. And so you all, I don't know why y'all don't want to talk. All y'all want to do is prepare for a test. I am more than a brain. I am a person who likes to talk and drink coffee. So you all, I am so proud of you. I want to let you all know how much I appreciate you, how much I love you all. And so even though we may never see each other face to face, just know that I'm praying for you. And Veronica, you go and you ace that test, girl. And then I think it was Jamie or Jaime has her test on Monday. You go and you ace your test. So I'm so proud of you all. I love you all. And if you don't have any more questions for me, I'm about to go to sleep. So good night, everybody. I appreciate you all too. Hold up, Mila has one more question. It's about Grey's Anatomy. You should watch Grey's Anatomy if you have. It's so good. It's a medical show, and I love it. Mila, I don't be having time to watch TV, but I will for you. All right. So Judy has a question. Yes, Judy, go ahead and ask the question. And Jose, you are a little late, but it's okay. I'm just asking questions right now. So answering questions. So Judy, what's your question? Judy is watching from Wisconsin. Hey. Good night, you all, but I'm going to stay here for Judy's question. So, Judy, what is your question, baby girl? Mila, I love you. Judy, I'm going to fall asleep on you, girl. What is your question? All right, so we're going to give Judy about 1 more minute to put that question in the chat, you all. You can do it, Judy. Treadmill games. I have so many questions about phlebotomy, so I'm going to put our main channel in the chat, and then when you go to our playlist, or if you just go to our channel and then type phlebotomy, I think I have 3 videos on phlebotomy certification. So thank you for asking. And I've not seen your name before, so if this is your first time joining us, we appreciate you. And you all don't forget to like and subscribe. And how do you all feel about these Tuesday night chats where we just don't talk about anything specific? Is this something that I should keep doing, or should I just keep doing questions? Y'all, I'm tired of questions. All right. So that's for you, Treadmill Games. When you go to our YouTube channel, you would just scroll down, or you can literally type in phlebotomy and you'll see our phlebotomy practice test. All right. So let's see. So because every state is so different, Judy, the questions that we have online, unless I say it specifically for Florida, the questions that I have online are good for every state. However, your skills may be different. So I'm going to recommend that you go to the Wisconsin Board of Nursing, go to their website. And if you just look it up on Google, and you're going to look for a CNA candidate bulletin. So you're going to look for the Wisconsin CNA candidate bulletin, And so you all, that's like the blueprint. Whatever state you're in, they literally have a blueprint to tell you what like the format of your CNA examination. So if you're in Kansas, you'd be looking up the Kansas CNA candidate bulletin. In Florida, it'll be the Florida CNA candidate bulletin. And so you would, of course, start with your board of nursing, go to your candidate bulletin, because in Florida, we can challenge the test. We don't have to go to school to be a CNA in Florida, unless you fail the test 3 times. But every state is not as generous as Florida. Remember, we have a large elderly population here. And so, our classes are 4 and/or 2 day classes. And we've been doing that now for well over a decade. And we really teach, we teach skills. And then you get your hybrid, you get your content online, you go in and you pass your test. And like, we literally had somebody who, after a 2 day class, beautiful young lady, she was offered 2 jobs, one at a surgical center and one at a major hospital, after a 2 day class, because the hospitals love the fact that you are a clean slate where you don't have any bad influences. They can train you up. And then if you have aspirations of being a nurse, they know once they get you in as a CNA, you'll probably be there for about 2 to 3 years. So I can't really one-on-one help you pass the Wisconsin state examination, but that would provide you with guidance so that you can at least know what's on the exam and then find out what the training requirements are. Okay. And so Treadmill Gain says, my question is, after attending Phlebotomy course, is there a formal sheet that you have to complete for your stick? So yes, it's NHA now. So NHA now. And so we do have a hybrid phlebotomy course, but if you already have phlebotomy experience, you're going to go to NHA Now, which is the National Health Career Association. They have a certified phlebotomy examination. And so you would have to have proof of your 40 sticks, which they'll have a downloadable sheet that you take to your employer. And once they sign off that you've had your 40 successful sticks, then you could submit that to NHA and, of course, practice for your test. They have materials online. And then once you take your test and pass, you would be a certified phlebotomist for the national examination. So I hope that made sense. All right. So NHA Now, and there could be some others, but that's one of the main ones that we're aware of. Okay. Let's see. Any other questions? Those are some good questions, you all. Okay. All right. If there are no other questions, I'm going to bed now. Mwah! Good night. Love you.